Nurse Natasha.
And I'm Nurse Natalie.
And today we have Asley with us, and we're going to be talking to Asley. She's a nursing student. Welcome, Asley.
Thank y'all for having me.
I'm so glad that you're here. So today we're going to talk about the importance of being in nursing school and being prepared and just her experience as a nursing student. So this is Nurses Week, so we're really excited to have a nursing student on. Hello, hello, send us likes, wave to us, show us some love, some hearts. So Tasha, you want to start with her?
Sure. So Asley, tell us a little about your background. What made you decide to become a nurse?
Well, I have been an LPN for about 10 years now, working in long-term care, and I feel the need for a little bit more growth.
Okay.
So I started my RN journey probably about a little over 2-3 years ago, but I actually started the nursing program of last summer, COVID summer.
So was that difficult starting it during COVID?
Yes.
Okay. Tell us what challenges.
Everything is via Zoom. We
Okay.
do not have any interactions with each other in class,
Oh
but
my
y'all know
gosh.
the interactions with your fellow nursing students. I mean, those are lifelong friendships that you'll never
Absolutely.
forget.
Absolutely.
So everything's via Zoom and group chats and group me. In the first clinical semester, all my clinicals were virtual via the VSIM, which there's nothing, you don't get anything from clicking a button that says wash your hands. But then my fall semester, I started actually going to the hospital, and that has been amazing. And I'm wrapping it up right now. I have 3 months left.
That is fantastic.
This is my final semester.
Awesome.
So far, what's been your most challenging class?
So far, the pharmacology. And normally, the pharmacology classes are only 1 credit hour. So you don't put much stock into 1 credit hour.
Exactly, especially when your sciences is like 3 and 4.
But they will squash you dead. So my recommendations for the pharmacology classes are flashcards.
Okay.
And listen during lecture, because they will occasionally say, make sure, listen up. Y'all might
Those
see
are
this
key
again.
words. Yeah.
And if you don't, you're going to see it.
So what are your study habits, your study methods?
Normally, I just go through the PowerPoints, and I like to write down everything. If I write what I copy, then I've got it. And then I'll read the chapter before I go to class, do all this I'm reading.
So pharmacology for me, I think that I use flashcards. What about you, Tasha? Did you use the flashcards too?
I did a lot of highlighting.
Highlighting?
But study groups work for me.
So you're a study group girl.
Okay.
So tell us about study groups.
Tell us.
With study groups, you're able to chime in what you know or what you grasp for the lesson versus what somebody else. They have talked about hypertension medication. I may have grabbed something that you didn't, whereas with another medication, you may have grabbed something. And that interaction between me and you together, you're telling me what you got and what I got. Together, it just paints a bigger picture.
That does bring up a very good point as far as patient education goes. Because whenever you're doing patient education, you want them to teach back what you have taught them. So
Return demonstration.
I do see where that is very helpful.
Somebody else. Say, for instance,
you kind of get off track with study groups. You'll start on one thing, and then next thing you know, you're talking about
something else.
Everything but what you're doing.
Awesome.
I can't shut up. in a study group.
Well, you and Christine shouldn't do study.
No, we should not.
We can't even do it during Zoom.
No. So, okay. So, you mentioned that the pharmacology was the hardest. I know for me, pharmacology was initially easy when I was doing pharmacology as an LPN because I was working as a pharmacy tech. So that repetition of seeing the medications, knowing what their interactions are, was helpful for me. So that's what you're saying, those flashcards.
It was awesome. The first semester,
It was sideways.
First semester, I made an A in pharmacology, and it was no problem because, like you said, you've given the meds, everything's. I'm good at the long-term hypertension meds that everybody takes.
Exactly.
But my last class was all emergency meds, which I don't really do emergency meds or chemo
That's like
drugs.
colds and when you're having to give the epinephrine and push meds and things of that nature. So
And
those
I'm
were
just-
difficult.
And surgery meds. I'm not familiar
Right.
with those because I don't give those.
Right. So what has working as a nurse done for you in nursing school? How has that helped?
It has helped with the fact that I'm familiar with the conditions.
Okay.
Because we have so many patients of various ages with conditions that range from everything. So
Right.
I'm familiar with all that.
And you get to see it. So that exposure means a lot.
Yes. And then as far as clinicals go, I'm good because I've had experience with patient care. And you know, everything is patient-centered care these days.
Yes. That QSEN or something of that. Yeah. So that was a little difficult for me when I was in nursing school as well. I wanted to talk to you about being a parent, going to school.
Oh, God.
And managing work life. How have you done that? How have you been successful?
It has definitely taken a village between my best friend, my mom, my husband, other family members. Everybody has been dedicated to the success of Asley, and I have been very grateful for that.
That's awesome.
Everything changes at a drop of a hat.
Right.
Like I went from day clinicals to night clinicals and then weekend clinicals. Because there is a shortage of clinical instructors. So you have to get, while the getting's good, to get your hours in.
Exactly. So it's like everybody's getting their RN. Your husband, your mom, everybody. Okay, so let's talk about give and report. A part of what we want to share as a Sbar community is to just give the exposure to proper communication. Proper communication between nurses, between practitioners, between family members. How has your school setting set you up to be a good communicator, therapeutic communication?
Because it's very essential to communicate.
Right.
You can't accomplish anything in nursing school without great communication.
Right.
And as far as the SBAR goes, I know it might seem lengthy and a waste of time while you're in nursing school and you just don't want to fool with it, but it's essential to patient care.
Right.
To know the background of your patients, the situations, why they're here, what happened during your shift, what do I need to do to my shift?
What would you recommend me
to
do?
help it go on.
Right.
And it's very important. And some nurses get in the habit of falling into, well, I'm not going to be here tomorrow, so just how they take their meds.
Let's just go through that.
But it's very important to know your patient's background and what's going on.
Absolutely. So you said you have 3 months left in school right now.
Yes.
How do you feel about your skills? How do you think your current school setting has set you up for skills like trach care and giving those medications and being active?
See, that is another thing that I think about quite frequently. Because I have so much experience, I am able to, I have these skills and it's not a problem. But as far as the new nursing students that have never touched anybody, it's hard because of social distancing. There's limited skills hours. There's limited time in clinicals in the labs. And we're broken down to groups of 4.
Oh.
And then it has to be done within 30 minutes. So you have to finish your checkoffs and get what you're supposed to get in that little bit of time.
Awesome.
So as far as the skills go, I have learned a lot doing clinicals, but just the years of experience as being a nurse.
And that's what's helpful. So do you think that there is going to be some type of, I'm trying to think of the right words, hesitancy with the nursing students that are coming out who haven't had experience?
I believe so.
Yeah.
I believe everybody's going to be really scared. But you're taught to just go in it like you've done it 15,000 times.
Right.
Just go.
When you see those memes out there, like if they ask you, am I your first patient? Like, no, I've done this 50 times.
On oranges.
So, we were talking with nurse practitioner Anita DeBose, and we had a live with her, and we were talking about the importance of physician to nurse communication. How do you feel about that?
It is essential. It's essential because y'all know the CNAs and the nurses are with the patients 24/7. The doctors are here, maybe look at them for 5-10 minutes, and then they got things to do.
Exactly.
So it is essential that whenever you see a change in your patient, you tell the doctor then.
Yeah.
Of course, assess the whole situation and do all your interventions to alleviate that beforehand. But don't ever be scared to talk to a doctor. They're just a person.
Absolutely, absolutely. And I think that's what she was trying to convey to everyone as well, that it's a communication, it's an interdisciplinary team, and everyone works together.
And they are just as responsible for these people as you are.
Absolutely. Okay, now you have children. Tell us about, well, you have a little baby girl. Tell us about her. And how has she been instrumental in you wanting to pursue continuing education and go further?
She is so supportive, and she is so into the videos. I like you said, she's gone to school with me.
Right, everyone's getting already.
Is she ever your patient?
Yes, all the time. She gets assessments every day, and then she likes to do the assessments on me and tell me what conditions I have.
So she's really getting an advanced education, believe it or not.
She really is. And then whenever she was talking about community helpers in her class, and she knew everything about the nurse and
what their job is.
She was exceptional. Yes.
Awesome.
She was exceptional.
Okay, so do you feel any anxiety? Weird question, but any anxiety about the NCLEX?
I feel nothing but anxiety.
I'm sure about anything, any test.
Every test. Because you only have 4 tests a semester, so you're taking everything and shoving it in, and then the NCLEX you're taking all of nursing school, and NCLEX is just a basic, general, don't kill nobody test.
Yes.
So I mean, there a lot goes into what is just the basic.
Yes.
And then you
that
learn
we ignore day to day.
Yeah, and then you learn so much more once you get into the world.
So I know that for me, when I took my NCLEX PN, it was very difficult because my machine shut off at 75 questions. I had so much anxiety, like, oh my gosh, did I get it right? Or did I get everything wrong? And they were like, she's not going to be a good nurse.
And back in those days, you couldn't pay extra to
get
your grade.
Yeah.
No, but there's something online where it shows that you can go and try to re-register. And if it doesn't allow you, that means you pass. And that's what I did.
That's what I did too. So if it doesn't allow you to re-register, that means you already passed, but you still have to wait for your results. Versus if it allows you to re-register, 9 out of 10, you didn't pass the test. And I think that that was back in 2012, 2013, when we did it, all of my nursing classmates were like, did it let you? And I was like, oh no, it didn't let me. I'm good. And a few of them were like, oh, I can sign up again. Like, yeah, I figured it was you. So one of the myths about nursing school is that only women go to nursing school.
No, there are a lot of men ranging from in their early 20s to their late 50s, changing careers, and there's a lot. I know there's a lot of EMTs.
Awesome.
A lot of EMTs. Most of the men are in the medical field
already,
or their wives are, or their sisters, or their moms. And
how do you think a lot of times people equate nurturing with a feminine type of background? Like if you're raised by women or you are female, that you do a lot better with nurturing. How do you feel that with your interactions with the male nurses?
See, they are more technical.
Okay.
And you're right, but they're technical. They like to be in the ICUs, the ERs. They want
fast pace, moving, that adrenaline pumping. Let's save the world. Yeah, they're superheroes. Yeah, in the sense of Superman, Batman. They're that type of person.
Yes, and I have noticed a lot of men in peds.
Oh,
which I didn't think that I would, but there's a lot of men nurses and peds.
Awesome. Well, I wonder, maybe they have the mindset that they just want to keep the kids happy and playful and joking. It's like that good uncle, that fun uncle. Maybe that's why they enjoy it, because it's a lot of laughter and fun, even though
and even on the oncology peds floor, it's majority men.
Wow.
Which again, the technical. It takes a lot to work with kids and do chemo drugs and.
Awesome, and keep them happy and
and support the families because they're going through so much.
Right. So, with school and to COVID, do you find that a lot of the interactions was talking about COVID? Did you guys have every point everybody wanted to bring up COVID, or did they stick to the normal curriculum?
They stuck to the normal curriculum. We really haven't covered COVID as part of the curriculum.
Okay.
Of course, we cover what we need to do in the clinical field and we've been on numerous quarantines
Okay.
because somebody's been exposed or we were working with somebody who had it and didn't know that they had it.
Right.
Like during my psych rotation, 3 people ended up getting it. So then we had to be on quarantine for part of med surge.
But still on the Zooms.
Yeah, and you still have to make up that time. That
Oh
time
my
word.
So it's not like business as usual. Is
No.
It? Yeah. So what's your favorite? What are you thinking you're going?
Your passion.
What's your passion with nursing?
So far, as far as my field,
Yes.
where I'm wanting to go,
Yeah.
I'm thinking trauma.
Trauma.
ER.
So you're a little technical too.
I am a little
I thought
bit.
for sure she was gonna say peds.
You are peds.
The children
No, I thought she
break my
was gonna
heart.
say
I
peds.
can't. And God bless the ped nurses, but I can't.
You can't do it.
I can't
So what
separate.
excites you about trauma? Is it that fast pace?
Just the fast pace and just getting it done. And to know that you are the difference between somebody dying and somebody living. Like, of course, all nurses
That
are.
immediate
and
gratification.
the immediate. And
Yeah.
then they go.
Yeah.
And the only thing about that is that you never know what happens
After.
after.
Yeah. Unless you see them back again.
Because, like, on the med surge floors, normally you have frequent flyers that you
Right.
know with chronic conditions, they're going to be back.
Right.
And then in the long-term setting,
They're there.
they're here.
They're your grandma.
They're here. So, and then peds, I can't separate my family from the children. I always put myself in it, and I can't.
It's hard to be
Different.
empathetic
Yeah, I
versus that
can't.
sympathy. You have that
Yes.
sympathy going on versus
just-
the empathy
it-
that's needed.
It tears me up.
Okay.
You want to leave geriatric after 10 years?
I want to leave geriatrics just for a little bit more growth because I've only worked in geriatrics.
Got it.
Now, I do have various patients from 21 to 101, but I want to try something different besides long term.
Okay. What are you seeing in a long-term setting you've been in the long-term for 10 years, so I'm sure you've seen the ups and downs of healthcare in long-term. What are you seeing as a trend right now as far as your patient quality and the types of patient you're receiving in long-term? Is it as it was before with your just demented?
I can answer that. No.
No.
I'm admissions coordinator taking anybody.
You're a
Anybody.
admissions coordinator. Oh
Anybody.
my God, who is she?
From 10 to 110.
If you got insurance, you welcome.
You're welcome. So, I know that from my perspective, the reason why as a nurse being in admissions, I find that the status of nursing and who needs rehab has changed so much. It is
really
no
has.
hip fractures. There is no knee replacements. There's no regular COPD, older patient. There's all alcohol abuse, drug abuse. Motor vehicle accident, gunshot wounds. Now they're paralyzed, have nowhere to go.
Related to substance
Yes,
abuse.
related to a substance abuse. Everybody's going through some type of withdrawal from something, or our older patients are completely healthy, just have dementia and nowhere to go, no one to take care
And
of
I
them.
feel like that's a generational thing. We're
Yeah.
seeing generational issues.
Yeah, it's like that whole when we go through psychology and it talks about those baby boomers and all those type of things. We're seeing that now where it was just a discussion before. It's actually what we're experiencing.
They're here. And
How do you manage that?
as far I
Don't
think-
beat up the admissions
No,
coordinator.
I mean, you just go with the flow.
Yeah.
Just go with the flow. You have to be flexible. You have to be able to coordinate your care based upon their needs.
Yeah.
Their roommate may not need the same thing that they need. So you just have to be flexible and just go with it and try to be relatable to them.
Yeah.
A lot of people like to stay in the nurse-patient
Role,
relationship.
yeah.
And I find that they have nobody else.
Mhm.
Majority of them are here because
This is their home
unfortunately
now.
they burned all their bridges during whatever struggles they were facing before they
Yeah.
got to this point.
Yeah.
So just be a friend. Just talk to them. Try to act like they're not a patient, that they're just a normal person that you're talking to.
Yeah.
And I've found that you're normally able to connect with them and get them to do more of what they need to do.
So before we let you go, I do want to talk about any tips that you may have for nursing students but as well, those tips that you may have for other nurses that are having a hard time communicating with families. I'm very passionate about the family communication in your education. Being that we're in COVID, we're not able to see our loved ones. They're in the hospital. They don't know what's going on. And they are their mom's advocate, their dad's advocate. And nurses, we've learned how to therapeutically communicate with our patients to be effective, but we have not had the opportunity to really home in and be healthcare givers to the families. What's one tip that you would give to a nurse that's having a hard time communicating with families during COVID?
Be an active listener. Because a lot of times they already know what's happening. They don't need you to, at that point, they just need you to listen.
Yeah.
Because they're frustrated, they're sad, they're depressed, they haven't seen their mom in a year.
Just need some reassurance.
They just need to say that they're upset. They just need to get that out. And then just reassure them that mom, dad, sister, they're fine. And they miss you too. And then just listen.
Okay. That's a really good point.
Because you can't fix it.
Yeah. Listen is a hard thing for me.
Yes.
And I think that
my mind.
it is a very hard thing for me. And I think that I want to be an educator, want to tell them. And you're right. They already know. They already know what the disease has done to the patient. They already know there's a decline. They just need the person to say that it's okay. You're doing the best that you can. And I think that part of nursing is a little harder for myself because I want to fix it, and there isn't anything that you can do when they have had so many comorbidities and they're so up in age, and there is no other intervention that would extend life to that capacity that they're looking for. So for a nursing student, what is your one tip for a nursing student going through this?
As far as schooling?
Anything that you want to share to a nursing student.
Just apply all you have. Because I know most nursing courses you can only take twice and then you have to start all over. So it's very time consuming and exhausting, and you're going to want to quit 15 times before you get there, but just keep going.
15?
Just 15.
Just 15.
Well, maybe 15 this week.
So,
but you can do it. You will do it, and just do it.
We think that's a really good point. Just keep going and apply all the knowledge that you have. So 2 things that we focused on during this live, I will add to the bottom. We had all the myths that were with nursing, and Asley dispelled a few of them, but there are some more added. And we also want to give her a big thank you for joining us today. Tasha has a wonderful gift for her that we'd like her to open.
We want Asley to open it. This is from Nurse Natasha and Nurse Natalie.
Busy mama, look how cute. Awesome.
She's expecting a little one.
That's another live.
She's been kicking this whole interview.
Oh my gosh, she's excited. She's a nurse too. So you are now part of our Sbar community.
Yes.
Thank you. We appreciate you joining us.
Very nice.
And we know you like journals.
I do. I love all things that I can write on.
Yes, we know you love to write.
And that's just a little, it can be a pen holder because I know you like pens, but it's also for makeup.
She likes pens and highlighters.
Me all day, every day.
Yes.
Miss Nurse Natasha is notorious for stealing all my pens. And
No way. Is that so?
Thief!
Busy bee.
Awesome. We so appreciate you joining us. Thank you so much for sharing with our listeners. Absolutely. So, this is Sbar Nursing with Nurse Natalie,
Natasha,
and Asley signing off. Thank you guys for joining. Until next time. Bye.